the topic of today's call is finding help or understanding if you're at the right doctor with the right doctor. And I just want to use a consultation I actually had today in the office with someone who has been struggling. This is we'll say 70-year-old female reporting 5 years of intense, as she put it, anxiety and depression. She also has Sjogren's syndrome, which is an autoimmune disease that attacks the glands of the head, so the parotid glands and the lacrimal glands, so it can drive dry mouth, dry eye, dry skin. So she's got that going on as well. And she's seen multiple doctors. So, she's seen the standard psychologists and psychiatrists. She's tried the medications and they weren't helpful. She reported a functional medicine practitioner, which I believe was a medical doctor. It had to be, in California over the phone. And this person, I don't know this practitioner, but this practitioner recommended she come see him for a 10-day program. And she couldn't do that because it was out in California and there were, pricing and reasons why she couldn't do that. So she was seeing him over the phone only and didn't get better that way. Then she saw a different functional doctor an hour and a half from her house. So she was able to go there in person, and that doctor did muscle testing to her and recommended supplements. And sorry, this doctor over the phone recommended supplements. And then eventually recommended Xanax as well. Prescribed Xanax, so that's how we know he was a medical doctor. She did not take it. Okay, and then today we spoke. And then also, sorry, actually, let's get rid of that. Today we spoke, but before that, she's also at the same time seeing an EMDR therapist. And EMDR stands for eye movement desensitization retraining. And that's a certain kind of therapy that helps with trauma, PTSD, things like that. It helps you not forget the experience, but it helps you have the memory without the stress chemistry. That's the goal of the therapy. So she's doing all of that, and then today we spoke. And a little bit more about her story. When we were speaking, she was telling me about this, and some of the difficulty with it is that because of the Sjogren's, her appetite suffers. Her appetite suffers because it's hard to eat because of the impact on the parotid glands. The saliva is suboptimal, so chewing and digestion in the mouth is difficult. Also, different foods are harder to eat than others, so that impacts her. She also has a lower appetite as part of the anxiety and depression. There. So that can be a double whammy there because you have low appetite because of, how you feel or because of your mood, but then you also have low appetite because of the actual, physical and biological process of eating is impacted through the Sjogren's. And so I asked her, she mentioned 5 years, it's been intense anxiety and depression. And she had anxiety and depression before that, but it got worse 5 years ago. So what happened 5 years ago? Well, 5 years ago, she also had what's called trigeminal neuralgia, which is pain in the trigeminal nerve, which is in the face. So the trigeminal nerve supplies your face the ability to like sensory to the face, but also motor to the face. And so she was having an issue where she needed to have neurosurgery on it because of the pain associated with it. And so 5 years ago was that surgery. And she said, so she had anxiety and depression, but leading up to the surgery, uh, the anxiety and depression ramped up associated with the surgery. And so this was 2017. Okay, so she had the surgery. Leading up to the surgery, she was on an SSRI medication or an antidepressant medication, and it was working. But for the surgery, she was also on trileptal, which is a medication to try and help the trigeminal neuralgia. And what happened is those medications started to interact. So she had to stop the SSRI until after the surgery. Well, post-surgery, the SSRIs never helped again like they did before. So now she's had the surgery and she's hoping to get the benefit from the medications again. Post surgery, she no longer does. So now the anxiety and depression is worse. And then in 2020 and 2021, she lost 3 siblings in that time. So she had 3 siblings pass away. And so I'm sure you all can imagine how that would increase depression because you lose 3 loved ones. And so she's got this triple whammy of the surgery that she had pre-existing anxiety depression. The surgery ramped that up. Coming out of the surgery, she no longer has the help that she had pre-surgery from the pharmaceuticals, and then she loses loved ones, which adds to the depression side. And then add to that the impact of anxiety and depression, lowering her appetite, and her appetite's low because of an autoimmune process that she has. And it's a fairly complicated case. And so she did, again, what conventional medicine would have you do. You go see psychiatry and psychology, and the therapy, maybe helped somewhat, but the meds no longer helped after the surgery. And then she seeks out functional doctors. So here's where I want to get to is, all right, the functional doctor in California, that's not necessarily a bad thing. I mean, you can be helped remotely by doctors. It's not out of the question and actually is happening every day. But in the more complicated the case is, I think over the phone, the less likely a doctor or the harder it is for a doctor to help you. At least in my opinion, I think it's important to be able to see a person in person, to examine them, get lab work, do whatever it is that you're going to do. So I'm not surprised that, this phone only case didn't necessarily help here, especially if they're just doing supplements, because it sounds like, okay, we heard your story. Here's the supplements we give when we hear anxiety and depression and see you later. So to me, that sounds very protocol, not super in depth in terms of investigation. Then the doctor she saw, well, before we get there, so they tried the supplements with this California doctor. When those didn't help, it's kind of like eventually, okay, well, here's some Xanax. and try that. And if she doesn't want to try that, that it kind of seems like a sign that she's reached the edge of what that doctor's willing to do for her or investigate for her. So then she sees a doctor more local, and this doctor does muscle testing, which again, when you if you're not familiar with muscle testing, doctors who do muscle testing basically can ask the body a question and test a muscle to see is it strong or weak under challenge. So, for example, you know, doctors who muscle test could put a vial of, say, vitamin C in your hand, or they'll muscle test you beforehand, see if a muscle is strong. So, like, they test your bicep and make you make a bicep and resist them trying to straighten out your arm to set a baseline strength. Then, if they're wondering, is a cell phone bad for you? Say they could put your cell phone in your hand, make the bicep, and they muscle test it, and you're weak. You can't resist their test. That would suggest that the cell phone is not good for you. The opposite is if they tested you at baseline and you were weak, and they wanted to know, do you need vitamin C? They put vitamin C in your hand and test you. Now you're strong. They may say, hey, you should buy this vitamin C supplement because your body's telling us you need it. So that's a one way that many doctors will investigate for many different issues in people, in patients, and it's a way that's been used for a long time. One of my good friends from school uses it every day, and he helps a lot of people, and so it does help people. Um, Personally, I prefer a more objective and reproducible investigation, and I look at it as, when I was in school and learning, I was like, this muscle testing is really cool. And again, it does work and help people, but I got to the point where, like, hey, what if I ever went to court? If I went to court and they asked me, where's the proof of why you did this on someone? If I hold up a piece of paper from LabCorp, the judge, the people in the court understand that, they have experience with that. If I said I muscle tested them and even showed them how I did it in court, that might look quote unquote weird to those people. It might not hold up as strongly in court. So my bias was to do something that held up more in court, and so my bias is lab testing and other objective diagnostics. And so this doctor did the muscle testing, gave her some supplements. She says she's been taking them. They haven't been helping. And so today she said, well, can you help me? And what protocol? Well, first I said, I don't know if I can help you because this is a 15-minute phone call. So, I can't tell anyone I can help them over a 15-minute phone call. But what I can tell you is that I will, what we do is we do the investigative work to find objective clinical targets that are, actionable and that we can follow over time after implementing care and retest and say, are you changing? And so from what you have told me about your experience with different practitioners, I can't guarantee you I can help you, but it sounds like I can tell you we'll do the most thorough investigation you've had so far on your case, and that's our best shot to be able to help you. And so I say all this to help you understand that there's different levels of investigation, and depending on how complex a case is, obviously the more complex your case is, the more deep investigative work you need to tease that out. And so if you've seen remote care and maybe not got the help you want, or you've seen a doctor that does muscle testing, or something else that maybe isn't as reproducible as lab testing, maybe you need to go to a lab testing type of investigation or some sort of diagnostics like a CT scan or an MRI, PET scan, those sorts of things to be able to find out a little bit more concretely what's going on in your case. Because if I've got lab work on you that says this inflammatory marker is high, we can both be accountable to that. We can say, here's a finding, let's take an action to address this. We go implement that action and we retest, and that number changes in a positive direction. We both know that we're changing physiology and what we're doing is working. And then we also hope that if we do that, that eventually either in step with that or soon after making that change, you start to feel better as well. And then we're really excited because we're changing not only your physiology, but also your experience. So again, if you're someone who's out there with a complex case, you've seen lots of doctors and you haven't got better, but all you've experienced is the conventional medical model that's just recommended medications without much investigative work, and you haven't got better, and you've tried maybe alternative methods and there hasn't been a lot of investigative work there, then perhaps it's time to stop the pharmaceutical or nutraceutical approach, which is basically using supplements the same way you would use pharmaceuticals without any investigative work. Maybe it's time to do investigative work to pinpoint the things that are wrong in your case, all the sticks and the spokes in your case. And then once you've got those, you can be specific and individualized to you with whatever recommendations they are, whether that's lifestyle, supplementation, medications, if you're working with a practitioner that can prescribe those, certain therapies, whatever it is, the more specific we can be to you, the higher the likelihood that you can get the help you need and hopefully return to optimal quality of life as well.
I just have a question. I'm kind of surprised, or maybe I shouldn't be, but did they talk about with this particular patient their lifestyle? I mean, what
Um,
they ate, how they exercised, all of that. Do you know?
the other doctors, you mean?
Yeah. I know you
Um,
did.
yeah. Um, I don't know for sure. She said they were functional practitioners, so that could mean a lot of things. My feeling with the California one was that once she wasn't going to do the 10-day program, it unfortunately probably the quality dropped precipitously there. Um, or their interest in working with her maybe dropped. So I'm not
Mm.
sure. The doctor in the hour and a half away from her, I'm familiar with, and they do some lifestyle things, but I don't know how much. And so she said she'd been there 3 times, and had supplement recommendations. So my suspicion is not as in depth as you and I would like. But the question behind that question is do I think lifestyle is involved? And absolutely, um, because anxiety and depression, um, I talk about in my book the mental health issues that the main hypothesis or thinking behind depression is what's called the monoamine hypothesis, where basically the accepted hypothesis of what's happening there is that you have a deficiency in serotonin. So you take a serotonin reuptake inhibiting drug like Prozac, and it helps you because you have a serotonin deficiency, basically, is what the thinking is. That we've covered this in other meetings and videos that you can find on my YouTube channel, but that hypothesis has been disproven many times. And in fact, anxiety and depression is not a deficiency of serotonin or of GABA, but it's due to neuroinflammation or inflammation in the brain. And what's driving that inflammation is different in everybody. And it's a different puzzle because it's not just one driver. And so here's where lifestyle plays in, because there's many lifestyle factors that impact our inflammatory status, as everyone on this call has heard me say before. So that's where nutrition, physical activity, stress reduction, sleep hygiene, toxin avoidance, EMF exposures, nutrient status, relationships, financial status, job, having a purpose, all these things impact our health and our inflammatory status. And so if I just hear anxiety and depression and say, take this supplement, I'm failing that patient because I haven't asked the questions about the things that have a much bigger impact on their case than likely the nutrient I just gave them in a capsule, right? So it's like that's where you're practicing medicine with nutrients. So that's basically the pharmaceutical model. Oh, you have anxiety and depression. Here's Prozac, see you later. You're in and out in 3 minutes. They did no diagnostics, no investigative work. Your doctor was a pill vending machine. You entered your complaint and it spit out a pill, and you don't get better. right? And the reason you don't get better is because A, they're operating from a mechanism that's been proven false in the large majority of mental health issues. But then the other reason you don't get better is they know nothing about you. They're not even asking about the things that you do all day, every day: eating, drinking water. Are you sleeping or not? Are you happy or not? Like, all these things matter. So if we're not asking that, if we're just giving supplements, we're basically just acting like medical doctors with natural products instead of with pharmaceuticals. So we need to be better than that and actually learn about the person and address any stick in the spokes lifestyle wise.
And one would assume, I'm not sure if labs were done here, but that if she was having trouble eating, that maybe she was having some malnutrition there,
Oh yeah.
or her body wasn't functioning properly and not absorbing the nutrients appropriately.
Yeah, absolutely. I mean, absolutely. And that I absolutely agree with you. I've only talked to her on the phone today, so I don't have any labs or any of that.
Mhm.
But one thing we discussed was she had said one of the doctors told her to cut out gluten and dairy, and her comment was, "I'm trying, but that's hard because with my appetite, I already can't eat so many things with Sjogren's. So it's hard to cut out these things too." And I said to her, well, this is where it gets complicated, because if you're eating gluten and dairy, which are two of the most pro-inflammatory foods out there, and they're abundant in the diet, and you've got quote unquote intense anxiety and depression, the only foods you can eat, or the foods you're maybe unwilling to remove because you're limited, are the foods that could be driving that complaint. So then it's like, how do you juggle the different layers of the case? And again, this is where testing and things can help us, because um, whereas someone with just anxiety and depression, you might say, hey, remove these inflammatory foods, and it's pretty easy. Someone with the added Sjogren's, where, hey, this is all I eat because, let's just suspect that the healthy foods we tell her to eat are harder to chew or whatever. Well, that
Mhm.
adds another layer.
That's it. Thank
And
you.
then, yeah, and then to your point, if you're only eating a certain food group, whether it's gluten or it's only spinach, you're going to become insufficient in certain nutrients, because spinach doesn't have everything, just like gluten doesn't have everything. So that's where supplements can be helpful too, while you're trying to get someone to a nutritional strategy that they can implement and sustain. You may need to use supplements to replete nutrients that they're deficient in, and or just provide nutrients that they're not getting because they physically can't eat enough right now.